Assalamualaikum and warm greetings to everyone that will be watching this video, including panels and lecturers. I am Mohamad Shafiq Ali bin Mohamad Hassan Ali. I will be presenting about my final year project, High Sensitivity Vibration Sensor for Cardiovascular Disease Detection. The background of the study is that the added workload on the heart is not yet fully optimized for early detection, and false interpretation is often being made, and this leads to late detection when the symptoms become even severe. Therefore, the cost for prevention, detection and treatment is expensive and requires various methods just to justify the patient's disease as well. So, the objective and scope for this study is to design a high-sensitive vibration sensor to detect cardiovascular disease and to enable early detection of cardiovascular disease as well. And the scope of my study is to estimate heart rate as a parameter for cardiovascular disease and to assist in detection of cardiovascular disease as well. For the flowchart of my project, methodology and literature review is dependent on one another. For the usage of piezo vibration sensor, I need to estimate heart rate and need to validate data that I have obtained from it. And both of it is crucially dependent on my literature review, where first I studied a morphology of human heart, the blood flow circulation system, and how do I identify cardiovascular disease and its causes, and whether there are any existing previous studies or sensors used to detect cardiovascular disease. Therefore, for my literature review part, human heart is located at the left side of the human body, the shape of pine cone. Normally, it's the size of a human fist. Human heart consists of two chambers, upper and lower chambers. Upper chambers consist of atriums, left and right atriums, and lower chambers consists of right and left ventricle. Atriums acts as a point where blood accumulates, while ventricle acts as a point where contraction occurs and blood are dispersed throughout the whole human body. Pulse pressure is actually from blood pressure, human blood pressure as well, where blood pressure is expressed as ratio of systolic pressure over diastolic pressure. Systolic pressure refers to ejection of blood pressure due to arterial pressure, and diastolic refers to ventricular relaxation. Normally, blood reading will be 120 per 80, and pulse is known as expansion and recoiling effect of ejection of blood, as high pressure gradient is maintained throughout the artery as well. And pulse and heart rate is not the same. Meanwhile, it depends on the type of measuring device that is going to be used. Pulse shows cardiac output and ventricular contraction, and heart rate could be estimated from the difference between systolic pressure and diastolic pressure as well. For the type of cardiovascular disease and its causes, first, stroke is due to interruption of blood supply to the brain. Second is aortic aneurysm, which is known due to aorta's rupture and dilation. Aorta is the largest artery in the human body. Third is peripheral artery disease, which refers to disease specifically in arteries within arms and legs. And fourth is coronary heart disease, which refers to the disease caused by the blood vessels transposing to the heart. And fifth, rheumatic heart disease refers mainly to the heart due to vascular damage and valve as well. The last one is congenital heart disease, which is due to genetic inheritance or intensive exposure during pregnancy. Out of all of these, all the risk factors that have been causing all this type of cardiovascular disease is due to blood pressure. High blood pressure is due to the elevated blood pressure at around 10 mm per mercury, and low blood pressure is due to the decrease in blood pressure to around 10 to 20 mm per mercury. And all of this, if we didn't control blood pressure well, it will cause instant sudden cardiac arrest. There are two general techniques in order to detect cardiovascular disease. First is by ECG, electrocardiogram. Second is by SCG, seismocardiogram. For ECG, it records electrical signals from the heart in order to detect any irregularities in the heart's rhythm and structure. And there are two types of ECG tests. First is Holter monitoring, second is stress test. Both of the tests dependent on how doctor is going to inquire on the patient's state depending on different kind of situation. For ECG, it refers to technique in detecting vibrations produced due to the heartbeat. Usually, it's placed at the chest with the help of an accelerometer. SCG refers to the improvement of the technique made by Monsi, which is ballistocardiography, in order to determine the response of intermittent blood flow for different causes of the body. SCG is going to be developed as a wearable system and is now in the current development, since there's wide usage of micro electromechanical systems as well. There are various previous studies and sensors that have been used to detect cardiovascular disease. First is simulation by using CFD, where ANSYS fluent have been used to set the velocity and properties of blood by obtaining the sample from a patient's hand. And second is electrical bioimpedance, where electrodes were placed at different positions of the hand and post-processing have been made for the required signals. Third is PPG, where green light have been illuminated with a wavelength of 900 nanometer, and the placement of the sensor should be intact with the skin, which is at the hand. The last one is accelerometer, where accelerometer should be intact with the skin, could be at the hand and chest, and it requires post-processing since heart rate variability occurs. For accelerometer and electrical bioimpedance, it could only capture the heart rate when the subject was steady. And for CFD, it could detect the presence of any blockage, while for PPG, it could capture the heart rate even when the subject were in motion, as long as the sensor were intact with the skin. For daily usage of products, for electrical bioimpedance is Aura Strap, for PPG is Apple Smartwatch and Fitbit. For a brief explanation on the technique to identify heart rate, first, the conduct of experiment were made by using 5 respondents, where they were instructed on how the reading will be taken. And second, blood pressure machine have been used to validate the data they have been obtained from piezo vibration sensor. Piezo vibration sensor that have been used in this study is LDT028K, which uses piezophilic membrane with silver electrodes to obtain the vibrations exerted at the hand and chest. And fourth, Arduino and ESP8266 were used to instruct and command the Microsoft Excel in receiving and transmitting signals from LDT028K. And fifth, Microsoft Excel with the help of Visual Basic application have been used to receive signals emitted from Arduino ESP8266. There are two positions where the LDT028K have been placed, which is first at the hand and second at the chest. Both of them have been accomplished by using Arduino ESP8266, and data will be processed in my laptop with the help of Visual Basic application. For data validation, Pearson's correlation factor have been used, where it gives the value ranging between -1 to 1 to determine the existence degree of relationship, and logistic regression have been used to determine particular events occurrence in terms of failure and success. Therefore, classification of true values are required since heart rate variability occurs and SH's reading will not be dependent on peak finding itself. Therefore, classification of true values have been made by true positive, false negative, and true negative. A true positive where the occurred event was a true success, and false positive where the event was a failure. For true negative where the occurred event was a true failure, while for false negative where the occurred event was a true success. Both Pearson correlation factor and logistic regression have been made by using data analysis solver in Microsoft Excel. PPV, positive predictive value, have been determined from the ratio between true positive and the summation between true positive and false positive. For the sensitivity of the sensor used, the ratio have been determined between true positive and the summation between true positive and false negative. Blood pressure machine reading have been acquired from the respective respondents as well, and age, gender, and height have been acquired to determine any effects on acquired data. And earlier, respondent 2 and 5, they have been preclinical diagnosed of low blood pressure and high blood pressure as well. However, from the acquired data, we could see the highest pulse pressure goes to respondent 5 and the lowest goes to respondent 2, which means respondent 5's data remains elevated heartbeat, while for respondent 2 remains lower pulse pressure among the rest. For my raw sensor data between respondent 1 till 5, they all showed similar trend, where the highest was 5-fold and the lowest was 0. And to show how it's being annotated, if you could see the animated video at here, each point have been annotated by using Microsoft Excel, and it will be only annotated when there is a successive peak between each other. Like let's say if you could see at here and this point, it have not been annotated. It's because it's not a successive peak that have been detected through Microsoft Excel with the help of Visual Basic application. And the formula that have been used to determine heart rate is the determination of period between each successive peak that have been determined in terms of seconds. Heart rate have been estimated from the annotated readings, and comparisons have been made for the reading in the hand and chest respectively for each respondents, and comparison have been made for among respondents for the reading acquired in hand. and the highest delay in time was recorded for respondent 5 and the lowest was for respondent 3. This is because respondent 5 have been pre-clinically diagnosed with high blood pressure, and the longer time of delay may indicate the presence of any blockage or any clotting factors from the pathway from the heart to the hand. And for respondent 3, since the person is the youngest, young people tend to have a higher heart rate compared to the older ones. And if you can see from both figures, there were glitches. Glitches was due to the unwanted motion artifacts, maybe due to unwanted movement or slight movement when the reading was taken. For data validation process, Pearson correlation factor showed a lower degree of relationship, which means it have exit value of 0 but it's not negative 1, or it have not reached the nearest to the value of 1 itself. This is because Pearson correlation factor only evaluates for the linear relationship. That's why logistic regression have been used. And from the reading that we acquired, positive predictive value at the chest is much higher at the than the hand. It's because the false negative readings at the chest is much lower than the hand as well. This shows that the reading at chest have higher sensitivity than the hand, and it will prove that reading at the chest have much better predictive values. In conclusion, delay of time taken for heartbeat could be used, which in study have used the delay of time taken between hand and chest, and implementation of piezo vibration sensor have successfully detected heartbeat with PPV of 0.525 and 0.552 at hand and chest respectively, and the sensitivity of the measured device at hand and chest was 0.60 and 0.70. And the usage of Visual Basic application could be implemented for public use in order to assist in detection of heart rate. This is because there is a lot of various open source software that is similar to Microsoft Excel. Thus, the VBA code, formula, and the functions could be used as well. For further studies, the number of respondents should be increased to determine specifically heart rate variability by focusing at the chest, since it acquires higher sensitivity in study with the help of ECG. Why higher number of respondents? Because the time that this study have been done, it was in a new normal situation. Therefore, number of respondents should be increased. And why ECG is because they have a much higher reading compared to blood pressure machine reading as well. Therefore, with the help of ECG, it will help to capture the heart rate with a higher accuracy and the same time as well. Therefore, thank you.